Okay, let's welcome our second consultant, Dr. Tariq and Dr. Islam. Okay, please introduce yourself.
Hello, everyone. I'm Dr. Islam Bostawi, consultant cardiology, associate professor of cardiology at Shams University. First, I would like to thank Dr. Da'a for her great efforts with us. Actually, I wouldn't have done it without your help. This is really true. I would like to share my experience, but first, I would like also to congratulate all my colleagues who I enjoy the journey with. And I wish success for all the new candidates. In order not to repeat a lot, as my colleagues said, I would like to tell you and share with you my own experience. Actually, as Dr. Tariq, my first and second parts were in 2020, and my background is cardiology. So we don't deal in Egypt with internal medicine so much. And in cardiology, we don't have a lot of differential diagnosis. It's a complaint, mostly one or two differential diagnosis, and that's it. For internal medicine, it's not that. So I was struggling at the beginning, and I think Dr. Da'a could remember this. At the beginning, the differential diagnosis idea was very difficult for me. So it took me much to understand what the basis is all about. So I would like to tell you some notes. First, the LCC, it's about solving a puzzle. And after time, I realized that missing one item of the puzzle may let you not able to solve it. So first, the scheme of the LCC, starting with the complaint, then the 10 questions, the systems, the symptoms of the system, and so on. Remember them by heart, but remembering this with heart is not enough. You have to study the disease so you can use this scheme to reach the differential diagnosis. At first, I studied the scheme without knowing how can I use it, and in some cases with Dr. Da'a, I asked the questions because I remember that I have to ask about this, but actually I.
Yes, Dr. Islam.
I don't have time. I will have time to write.
Yes, الفويس بس قطع في النص. Uh, are you with us, Dr. Islam?
Yes.
Yes, fair enough. Yes, so just a moment.
Can you hear me? Like.
Yes, can you see the screen now?
Yes. That's why I would like to thank Dr. Ahmed Shaban and Dr. Riham, who sent me the notes 10 days before the exam. So this is my first mistake. The second one was that I wasn't familiar with not using jargons. So it took me much to know how to use non-medical terms in communication or non-medical terms in taking history from the surrogate. This was my second obstacle. In the exam, my first case in the LCC, from outside, a patient coming with fatigue. Inside, I realized that the patient has double valve replacement with fever, with history of tooth extraction 1 month ago. And it was provisionally in a case of infective endocarditis. The second one from outside also, it was fatigue. From inside, I discovered that the patient has ulcers, mouth ulcers, joint pain, photosensitive rash, and the diagnosis was systemic lupus erythematosus with renal affection. In communication, my first case was to deal with not a patient, with a family member with history of Lynch syndrome in the family, and my job was to tell her about the importance of doing a colonoscope. And inside the case, I discovered that the gene test was done without her approval. So I apologized for her, considering it a medical error. A second case was a patient with stroke who was on oral anticoagulation, as I remember. That's it. Finally, I would like to advise you to make a team to study with, practice the steps of examination, practice on yourself, on your family, on your colleagues, practice as much as you can. The short stations depend on how fast are you to finish the examination in the proper time. And I wish you luck.
Okay, Dr. Islam. Actually, Dr. Islam, I was impressed like by يعني your way of like being to the point, targeted. And you told me that I will tell you how to deal with cardiologists. I would like to know.
Cardiologists are not physicians. So, so you deal with a naive internal medicine candidate.
Yes,
So as I said at the beginning, we don't deal with differential diagnosis as much. So
yes,
this is my first point. Making differential diagnosis was very difficult for us. For example, in solving a puzzle of LCC, a patient with, for example, description of a rash that will be at the end erythema nodosum. It may be sarcoidosis. It may be BIHST. It may be associated with inflammatory bowel disease. The patient doesn't come saying to you that I am sarcoidosis.
yes,
He just mentions a complaint. We are not able to formulate so much data to say this may be sarcoidosis, this may be BIHST, and this was what I did at the end. I collected the data, for example, what are the diseases that cause, for example, erythema nodosum? One, two, three. How to differentiate? What are the similarities? Sarcoidosis may lead to erythema nodosum, uveitis, arthritis, BIHST as well,
yes,
inflammatory
points,
bowel
just
disease as well.
points.
So
Yes,
how to differentiate between them? So I realized that I can differentiate between these three diseases by asking about ulcers, genital ulcers and oral ulcers in BIHST. For example, this point in sarcoidosis, diarrhea in inflammatory bowel disease. And I followed these rules in all the complaints to know in the limited time of the exam how to differentiate between points.
yes,
And that's
yes.
it.
Yes, very, very, very nice point. Actually, yes, I would like to emphasize also on the role of the team. You are like a great team. You, Dr. Amr, and Dr. Tariq, like excellent team.
Yes, we practiced a lot in the last 7 days.
Yes,
We did all the examinations about each other, a neuro examination, abdomen, all of the examinations we did, and we used the stopwatch to monitor the time.
yes,
What are the steps that we missed in the examination, and so on.
yes. Okay, Dr. Islam. Last advice for those who will took their exam like in 3 months to go step by step in their preparation, easiest way.
Study from the beginning. listen carefully to the recorded sessions, and make a team. That's it.
Okay, fair enough. Thank you, Dr. Islam. Thank you. Thank you. I will miss you so much.
Thank
I will
you.
miss all of you.
Thank you, Dr. Daya.
Okay.
Thank you.
Okay. Thank you, Dr. Islam. Okay. Thank you for all the successful candidates we met today. We still have Dr. Marwan, Dr. Amr, but I think they are. I'm not sure if they are here. We may like arrange another meeting with them. Just in a couple of minutes, I would like to have a plan for those who will like join us in the next course. Any of you who are preparing for their basis exams soon. Okay, basis actually is very easy exam, but it is very difficult to pass. Why? Because it needs like special preparation. Okay, I think 3 months for concentrated plan is enough. 6 months for extended plans for those who are like have another duties, have family issues is enough. Okay, you need to know that basis is 5 like stations. You will have the 2 LCC, the 2 communication stations, and the 4 short stations. Okay, just in brief to summarize all what the candidates said. As regard the skills, you need to be prepared skill wise. As regard the 4 short cases, the shortest way it is to start your preparation by taking a clinical course. Try to take the clinical course as early as possible. Depending on your country, if you are like in the Gulf, if you are like in India or Egypt, try to choose a clinical course. Stick to it from the start. From your clinical course, you will pass into 2 phases. Okay, phase 1 of the clinical course is depending on to memorize how and to learn the examination. Think of examination as if you are learning something like driving a car. Okay, so step 1 is to go into learning how to drive the car, okay, without hesitance, without thinking about the next step. So you need to be sleek in your cardiology, chest, abdomen, or neurological examination without thinking much of the steps. This is number 1. This is usually takes at least a week. I think most of us need further practice. Is to this happens when you move from learning the steps of the examination into only thinking about the positive finding. So you go for the examination, you start to examine without realizing the steps. You just go pilot way. You start to examine. All you think about is what are the positive finding in your clinical case. Okay, so at that point you could summarize with your mind. It is a mind problem. What are the positive finding, and have like a puzzle together the clinical symptoms and what are the cases, the diagnosis and differential diagnosis. This is very clear in the abdominal stations and then in neurological stations, and you can't reach that point until you are very sleek in your clinical examination. Okay, the second advice in your clinical cases is to summarize the diagnosis, differential diagnosis, the main approach, the scheme. It is a case of upper motor neuron lesion, so I can think of 1, 2, 3. It's a case of lower motor, I can think of 1, 2, 3, and go through that approach. Stick to it. And try to practice the discussion, please, because many short cases you will go inside and you may miss like marks in the judge in the discussion because you missed very important thing, very easy thing, like missed chest X-ray, missed sputum culture, missed spirometry, like this. So please summarize the discussion, only 5 minutes discussion. So please memorize just words. Nothing more, nothing so complicated, but please, the important point need to be memorized by heart. This as regard your clinical. I recommend to start taking your clinical course at the beginning of the 3 months, followed by a mock exam near the exam, and the week of the exam, week before the exam, and in between try to practice with your friends. And if you are have no access to real patients in the hospital, so please practice on your like family members or on a doll. Any simulation is enough. Even mental practice in the clinical examination is more than enough, just so that your the neural network is fixed and you will not not miss any steps. Okay, this is as regard the short cases. We will lift with, actually having a short case is not guaranteed in the basis, because even if you are like 100% prepared, you may struggle or face a case that it is unusual. In acute case, the patient is not like cooperating with you. You can't expect what you may face in the short cases. So what we left in this basis exam to pass is to be very well prepared as regard the LCC and as regard the communication. And actually, I'm 100% guarantee that if you are very well prepared with having exposed to wide variety of cases before in this LCC and in this communication stations, you will face very similar cases. Alhamdulillah, last night, I think all the cases we got in the course. So it is not a big deal. It is all about to be prepared on time and to pass through all the questions. So as regard the LCC, if you are lucky to have an organized course, I welcome all of you to join our course and join our free sessions. So please study the LCC. First, start to have an approach, starting from the personal part of the personal history, followed by analyzing the complaint, the special question of the complaint, followed by the 10 general questions, following by the past history. Through this main approach, you will mainly got the positive finding. After studying the approach, the main approach for all the LCC case, you need to have approach for each complaint. So organize the complaints into systems: in neurology system, cardiovascular system, respiratory system, endocrinal system, rheumatological system, like this, woman-related complaints. Okay, have an organized study plan. I will share with you in the group, so that each complaint, maybe shortness of breath, you need to have fixed questions to analyze. Shortness of breath is a cardio chest complaint, so I have some questions. Having a problem with menses, maybe menorrhagia, oligomenorrhea, I have some scheme. Having weight gain, weight loss, fever, fatigue, difficulty walking, all of that, you need to have fixed questions so that you can have a diagnosis and exclude other differential diagnosis in these complaints. So fix an approach, a universal approach first. Fix a specific question for each differential diagnosis. Number 3, you need to fix a systematic review, so that if the question is related to the cardiovascular system, I know all the cardiovascular question. If the questions is GI, I know all the GI screening questions. If it is neuro, I know all neuro questions, and what so on. After that, after having an approach and analyzing of the complaint questions and having a systematic review questions, I need to be exposed to as much ideas as I can. I can have these ideas from where? From the recalls. You have the recalls. I will send them to the group. The recalls of Egypt and overseas and UK stations. So from these recalls, please try to revise the recent complaints and be prepared with suitable differential diagnosis. You can have this differential diagnosis from a ROH. This is the only book I advise. I don't advise rider at all. It is like far away from the real exam. So a ROH is enough with some systematic course, and you can attend other like free sessions, but please be stuck to your own course and don't change the approaches. Okay, after doing that, you need to be prepare as much as you can. Please be prepared so that you spell the words, you know what the next question will be without even thinking about this. This is very important, to be very sleek in your history taking, not hesitant, not to think about the next questions. When you are like preparing, when you are preparing in your like real case, when you are like in the real exam, you need to have the paper. In our course, inshallah, we will start by teaching you how to prepare the paper from outside. The day of exam, actually, what's left from the course is the white paper you got into the station with. So this white paper you need to write from outside, and inside the exam you need to check on the questions, and so that you are not missing any questions. And you need to write the positive finding in the exam. What's more important also is to be prepared with the specific examination needed for the LCC. The targeted examination need to include the general examination, that's the general five examination, followed by the examination of the complaint, followed by examination to exclude the differential diagnosis. So write this down in your paper from outside. Okay. So actually, to get a good mark in this LCC, you need to have like virtual knowledge. This need to be prepared at least in 3 months, and you need to have the real patient practice. This need to be practiced either with your consultant in the hospital or in your consultant or with in the courses. Okay. Yes, the general examination include like starting from the hand examination, okay, up to the pulse, and followed by the eye examination for the pallor and jaundice, and then the mouth, the tongue for cyanosis, and then the GVB, and finally the lower lymphedema. This is fixed before starting any special examination. This is as regard the LCC. Actually, if you got the LCC case, you pass the PACES exam, because it like carry two large stations, lots of mark to cover. As regard the communication, I always say that preparing communication is very easy. It is like divided in 2 parts. Part number 1, as regard the communication, it's all about the approach and the language. So you need to be prepared with a universal approach for the communication. The intro need to be fixed to start confident in the communication. Need to fix an intro, okay, and to have special answers and special language which you can speak confidently and use to it as to show the empathy, the sympathy, to answer if the patient is complaining, if the patient is angry. So you need to have fixed answers for these questions. You need to have fixed answers for the concerns, as you need to explore the concern. What do you mean like this? This is number 1, and this is very easy, but try to be fixed, not to try the communication each time differently. Number 2 is the basic communication knowledge, the ethical issues, and this also need to be studied. Like you have like a study plan I will send to the group with the like topics you need to study, starting from breaking bad news, followed by the complaint, scenarios related to drug adverse events or drug side effects, how to explain a procedure, how to explain a disease, how to deal with the DNAR, how to deal with elderly related scenarios like this. So you go topic by topic. You need to know what is need from you, what examiner need knowledge from you as regard these topics. There are like few hints in each topic you need to answer, and few concerns. Okay, so you need to be prepared with these points, okay, in the easiest way, and have fixed concerns. And remember always to practice these communications so that you are slick. This is all about the preparation of the basis. Basis actually, in Arabic we say it as سهل الممتنع. It's very easy, but actually it's very easy also to miss. So being prepared will like prevent you lots of tears and lots of sweat, and not like distract yourself with many resources. Basis, you don't need so much knowledge. You need also only to answer like a reasonable amount of knowledge, only to answer the 5-minute discussion, which is like so quick and easy to miss. Okay, so you need only to be targeted. This is all about bases. Okay, so before we end this session, any questions? Okay.
Yes.
Yes.
Go ahead, doctor. It's fine. I'll ask next.
Yes. Any of you? Any questions? Dr. Samar, is it clear?
All right, then I will start. Yeah. Okay, so Dr.
Yes.
Dae, do you recommend a specific clinical course with Dr. Ramadan or with Dr. Ahmed Maher?
Okay. Yes, I can like send you this this in private, but there is like main points to like tackle in your course. Okay, number one is to prepare as regard the clinical skills. Okay, and to be to see as much cases as you can. Many of the candidates actually take both courses. Yes, I know many of the candidates, and I will like tell you yes in private as regard both. Yes. Any further questions?
Okay. Yes, please. You mentioned about sending us some resources to study before the start of the course. Did I get that correctly?
Sorry, study partner or studying material?
Studying material, I mean.
Yes, actually, I advise for to start with the ROH and to go through past test videos. Other than the course
Okay.
actually is very dense. Okay, so all you need is just like catch with the course, study day by day, and all this is all what you need. Yes.
Okay, so a ROH only pacemaker book, or the separate books like the ones with the hematology, the neurology?
No. The pacemaker one.
The pacemaker one. And how about step up to MRCP? I know that it's mainly for MRCP part 1 and part 2, but I found it very helpful. So do you think I should go through it again, or
no need? Like in my personal point of view, if you have ChatGPT, this is much like handy to use. You need only to know diagnosis, differential diagnosis, some points as regard the investigation treatment, nothing more. Yes.
Okay. Thank you so much, doctor.
Thank you. Okay.
Dr. regarding the ROH book, do you mean the whole one? There is any like summarized one, or this is the one?
Yes. This is very nice. This is a very nice question, Dr. Ahmed. Okay, ROH actually is like 3 parts. Okay, ROH from the first part of ROH is communication. Okay, in communication, ROH is somehow old. Okay, so not to stick for any take some knowledge, know about the topics, but have some concerns answered. But this is not the scheme which you go in the real communication station. This is number one. So just know a general knowledge about the communication. And the 2 parts in the middle, one with the complaint, you will have some like complaints, and after the complaint they write some differential diagnosis. This is actually the most important part of the ROH, is to know the complaint, the case name, and underlying the differential diagnosis needed to know. This is very important, and I think same cases coming again and again. And after that, he will write some questions to exclude the differential diagnosis. Actually, this is very important question. Why? Because like taking this is the old style of the LCC cases, is to ask about each differential diagnosis without seeing the patient. This is very different from the recent, because bases have some modification. So if you go into bases LCC stations with this point of view, you will take so much time, because at that time they were not examining the patient. What I prefer is to know the question, know the differential diagnosis, but please stick to our approach in tackling the scenario. Is go the main approach, the universal approach, followed by special question for the complaint. And finally, if you want to exclude some differential diagnosis, ask, but not to start by asking the differential diagnosis style, because ROH is written in that way. Okay, the third part of our ROH book is the multi-system examination. This is also very important to study. He will like bring acromegaly, and he will write the ideas of acromegaly case, followed by the special examination of multi-system, because acromegaly you need to examine multi-system, cardiovascular, abdominal, joint examination, general examination, all of that. So it is very well organized. So our ROH need to be like taken wisely. I hope I answered the question. Yes.
Okay, thank you. One last question, please.
Yes.
When are we going to start, and will we have a timetable so we know that like the upcoming sessions will be whatsoever?
Okay, inshallah, we will start Saturday, Sabt, inshallah. We will just like waiting for the group to be complete, and then the time frame will be Saturday, Monday, Wednesday, from 8:30 to 9 p.m. Cairo time. سبت يعني سبت 2
Okay.
4 الساعة 8:30 للساعة 9 بتوقيت القاهرة إن شاء الله. Maybe يعني we will need to add some sessions. We will see. But I think 3 months more than enough for all the candidates to finish their 12 cases. Yes.
Okay. Which topic we will start with, or do we have in like
yes,
order
we will
for
start.
topics?
Yes. As regard the LCC, we will start with general examination or general complaints, the fatigue, the fever, and the weight changes, weight loss and weight gain. And as regard the communication, we always start by the general scheme, followed by breaking bad news. This is usually we start with.
Thank you very much. Thank you.
Okay, thank you, Dr. Ahmed. Okay, any further questions?
Do you have those 3 parts of Al-Ruh? Can you share?
Yes, I can send to the group. Yes.
Yes,
Okay, I will send to the general group, Dr. Malik. Yes. Okay. Any further question? A last question before we end the session. Okay. Thank you for all of you. Thank you for this session. Thank you, Dr. Tariq, Dr. Islam, Dr. Riham, Dr. Aya, all of you who attended the Dr. طبعا Dalia, all of you who attended the session, and those who didn't have time, Dr. Marwan and Dr. Amr, we will arrange another session with them. I will miss you all. Okay, thank you for your time. Hope you meet soon. Okay, thank you. مع السلامة.
Thank you so much.
Thank you. Bye. Thank you.